What started as a pharmaceutical drug used to treat severe pain has now become a leading cause of overdose, and death rates are only continuing to rise. Cronkite News reporter Madison Thomas spoke to individuals in all different fields to learn why this is happening and what should be done about it.
According to federal data, there was a national increase of roughly 20,000 overdose deaths involving synthetic opioids from 2019 to 2020. Fentanyl is believed by many to be the most dangerous drug in America.
I've been in law enforcement for well over 25 years, and this is the most terrifying thing I have seen is this fentanyl crisis.
Fentanyl can be up to 100 times stronger than morphine. The DEA reports that 4 out of every 10 pills with fentanyl has a potentially lethal dose.
They think, oh, it's a little pill. It can't be that hard. It looks like an aspirin. I'm going to take that. And it could be deadly.
Arizona State Senator Christine Marsh sponsored a bill last year that legalized drug test strips, which tell people what is in the pill they are taking. This came after she tragically lost her own son to a fentanyl overdose.
His death had a huge effect on the direction I was going with legislation.
Senator Marsh says her son was not a drug user. He traveled down to Tucson with some friends where they believe he purchased what he thought was a Percocet.
Landon would want, like, me or, his death. He was so practical. I think he would want, like, his death to potentially result in something positive.
Making test strips illegal has helped the organization Shot in the Dark legally be able to supply them to people in need.
It makes people feel a little safer testing stuff and being like, okay, there for sure is, right? It might sway the person to use a little differently or a little safer at that point.
Shot in the Dark is a syringe service program that travels across the Phoenix area, providing people with harm reductive resources.
We're not focused on abstinence or anything like that. Our job is to keep people alive long enough for them to reach some form of recovery.
Jonathan Martinez says that addiction can happen to anyone.
It could be a soccer mom, it could be assistant chief of police, it could be anybody. Just because it's not happening to you directly does not mean that it's not happening everywhere around.
Dr. Foster Olive believes a strong step in combating this opioid epidemic is to find new forms of pain relievers.
I think in terms of, like, if there was some sort of way to create a very, very good pain reliever that is not addictive and not necessarily an opioid, maybe it's a different molecule that which we don't understand how it works, but it somehow doesn't interact with the brain mechanisms of addiction.
One common message rang loud and clear from everyone. All it can take is one time.
One pill can be a death sentence. I'm living I'm living that reality.
If you are struggling with addiction and need help, the Arizona Department of Health Services hotline number is 1-888-688-4222. In the newsroom, Madison Thomas, Cronkite News.